The puppy was small, thin, and alone on the side of a road in the Philippines. Birgitte Kallestad picked it up, placed it in the basket of her scooter, and brought it back to her resort. She washed it, fed it, and played with it in the garden for days. It nipped her fingers the way puppies do. She cleaned the tiny scratches with disinfectant and thought nothing more of it. That was the moment the clock started. Birgitte was 24 years old and worked as a healthcare assistant at Firda Hospital in western Norway. In February of 2019, she went on holiday to the Philippines with a group of friends. None of the group had been vaccinated against rabies before the trip. The Philippines was not on Norway's list of countries that required a rabies vaccine. She finished her holiday, flew home, leaving the puppy behind, and returned to work at the hospital. The scratches healed. She forgot about them entirely. What Birgitte could not see was what had already begun inside her body. The rabies virus is not like most infections. It does not travel through the bloodstream. It does not trigger a fever or raise an alarm in the immune system. Instead, it hides. When the puppy's saliva entered the small cuts on Birgitte's fingers, the virus settled into the muscle tissue around the wound. It stayed there, replicating slowly and quietly, remaining below the threshold that would normally trigger an immune response. The virus produces very little of itself in those early weeks. It keeps its numbers low in order to avoid detection. The immune system does not notice it. There's no inflammation, no swelling, no redness, no sign that anything is wrong. This is the incubation period. It can last anywhere from a few weeks to over a year, depending upon the location and depth of the bite. For Birgitte, it lasted approximately 2 months. Then, the virus made its move. It found the nearest nerve ending. Specifically, it attached to receptors at the junction where nerve cells meet muscle cells. These receptors are designed to receive chemical signals from the brain that tell the muscle to contract. The virus mimicked those signals and was absorbed into the nerve. Once inside, it began to climb. The rabies virus travels along nerve fibers in one direction only. It moves backwards, away from the muscle, towards the spinal cord and ultimately the brain. It travels at roughly 15 to 20 centimeters per day. It hijacks the nerve cell's own internal transport system, the same mechanism that the cell uses to shuttle proteins and nutrients along its length. The virus rides this conveyor belt like a passenger on a train, pulled steadily inward towards the spinal cord and the center of the nervous system. It does not need to do anything. The cell does the work. This is why the location of the bite matters so much. A bite on the face or head means that the virus reaches the brain in days. A bite on the foot could take months. Birgitte was bitten on the hand. The distance from her fingers to her brain gave her roughly 8 to 10 weeks before the virus arrived. Now, during this journey, the virus does something remarkable. It does not destroy the nerve cells it infects. Most viruses kill the cells they invade. Rabies does the opposite. It keeps the neuron alive. It actively blocks the cell's self-destruction program, a process called apoptosis. The virus needs the nerve cell intact because it's using it as a highway. If the cell dies, the road collapses and the virus is stranded. So, it preserves its host cell while quietly replicating inside it, producing new copies that spread to the next neuron in the chain. The immune system still does not respond because the virus never enters the bloodstream. It stays hidden inside the nervous system, moving through internal cellular pathways that immune cells cannot easily reach. It is, in effect, invisible. Roughly 2 months after her holiday, Birgitte began to feel unwell. She developed a headache and a low fever. She felt a deep, heavy exhaustion that rest could not relieve. She noticed a prickling sensation in her hand near the old bite marks, as if the skin itself had begun to buzz beneath the surface. This strange feeling at the site of a healed wound is a hallmark of rabies. It means that the virus has reached the spinal cord and has begun entering the lower regions of the brain. At this point, the virus starts to interfere with how neurons communicate. Healthy nerve cells send signals by releasing precise amounts of chemical messengers across tiny gaps called synapses. The rabies virus disrupts this process. It blocks the release and reception of key neurotransmitters, the chemicals that regulate mood, muscle control, and automatic body functions like heart rate and breathing. The nerve cells are still alive, but they can no longer do their job properly. The wiring is intact, but the signals running through it no longer arrive cleanly, producing moments where her thoughts felt slowed and then suddenly agitated. Birgitte visited the emergency room. Doctors saw a young woman with what looked like the flu. They had no reason to suspect rabies. Norway had not recorded a human rabies death in over 200 years. The last confirmed case on the Norwegian mainland was in 1815. Rabies simply was not part of their diagnostic thinking. She was sent home. Over the following days, her symptoms worsened. She became anxious and restless. She couldn't sleep. She felt strange sensations moving through her limbs. Her throat began to tighten. This is the onset of what's called furious rabies. It affects roughly 80% of rabies patients. The virus had now spread deep into her brainstem, the region that controls swallowing, breathing, and the regulation of saliva. Here, the virus caused the muscles of her throat and larynx to spasm violently. These spasms were triggered by the act of swallowing, or even the intention to swallow. Birgitte was desperately thirsty, but every time she tried to drink water, her throat locked shut. The pain was immediate, sharp, and overwhelming. Her body convulsed. Even the sight of a glass of water was enough to trigger a spasm. This is hydrophobia. It's not a psychological fear of water, it is a physical reflex. The body learns that swallowing causes agony, and it begins to reject water on sight. The patient is fully aware of what is happening. They know they need to drink, they want to drink, but their own body will not let them. And the virus benefits from this. Rabies replicates inside the salivary glands and concentrates itself in saliva. If the host swallows, the virus-rich saliva enters the stomach and is destroyed by acid. By preventing swallowing, the virus keeps its highest concentration exactly where it needs to be for transmission, in the mouth, ready to be passed through a bite. The body also begins producing far more saliva than normal. The combination of excess saliva and the inability to swallow creates the foaming at the mouth that has defined rabies in human memory for thousands of years. It is not a symptom of madness. It is a biological strategy. The virus is engineering the conditions for its own spread. Birgitte was admitted to Firda Hospital, the same hospital where she worked. Her colleagues now cared for her as a patient. She drifted between brief windows of clarity and longer episodes of agitation, confusion, and fear. A doctor finally connected her worsening neurological state to the puppy bites that she had received abroad. Blood samples were rushed to Sweden's public health authority for testing. 3 days later, the results confirmed rabies. But by then, it was far too late. Once symptoms of rabies appear, the disease is almost always fatal. There is no antiviral drug that can clear the virus from the brain. The damage is not structural in the traditional sense. The brain tissue doesn't swell dramatically or visibly decay. The neurons are not destroyed. Instead, the entire communication network of the nervous system has been quietly disabled from within. The signals that keep the heart beating at a steady rhythm begin to falter. Breathing becomes shallow and uneven, each inhale shorter than the last, the rhythm no longer steady. The body loses the ability to regulate its own temperature. Birgitte's awareness faded as the virus silenced one neural system after another. She could no longer speak. She could no longer recognize the faces around her. She slipped into a coma. 8 days after she was admitted, her heart stopped because the brainstem could no longer send the electrical signals required to keep it beating. Birgitte Kallestad died on the 6th of May, 2019. She was 24 years old. It was the first human rabies death in Norway in over 200 years. Her family released a public statement. They described her as someone who loved animals. They said that their greatest fear was that this would happen to someone else with a warm heart like hers. They launched a campaign urging Norwegian authorities to add the rabies vaccine to the recommended list for travelers to the Philippines and other countries where the virus is common in stray animals. There is a difficult truth at the center of this story. Rabies is almost entirely preventable. A course of vaccines given after a bite but before symptoms appear is nearly 100% effective. This is called post-exposure prophylaxis. Birgitte cleaned her wounds with disinfectant. She did what most people would consider responsible. But rabies requires a specific medical response that goes far beyond just cleaning the wound. The window between the bite and the first symptom is wide open, sometimes weeks, sometimes months. Treatment during that window works. Once the window closes and the virus reaches the brain, medicine has almost nothing left to offer. The World Health Organization estimates that rabies still causes around 59,000 human deaths every year. Almost all of them are in Asia and Africa. Almost all of them result from dog bites. And almost all of them are preventable. Life is fragile. Treat today like it matters.